Okay, great.
All right, we're live.
Okay, all right, good. Um, so I had a few things that I wanted to chat about.
Yep.
Let me just see. Oh, yeah. So I needed to finalize the subject guide and the assessment.
Yes.
And then I needed you to show me how to, in LMS, how do I create groups so that the students can go in and select a working group that they're going to use for assignments and stuff like that?
Oh, yeah. Okay. All right.
And is that possible?
Could you see my down? Yes, it's easily done. Just not by me. Just so easily done. Um,
Okay.
I would probably be flailing around a little bit and then having to use Google search. But if Grantham walks into the room while we're um, having our little meeting, then I'll get him to jump in. He can show us both. He's shown me a
Yeah,
couple of times, but I keep forgetting it.
yeah. Connie knows how to do it, but she's sick. So when she
Right.
comes back, it's not anyway. That part's not urgent.
Actually,
And then
what you prompt me to think is we need to get Grantham putting his instructional videos into the Teachers of Health Professionals
yeah,
website. So we'll get him on Google Hangouts and recording a demo on how to do it.
yeah, that'd be good. I actually found some instructions, a PDF that Uni Melbourne put up
Right.
somewhere. I'm trying to access, and I wasn't sure that I was doing it properly. So
Had to be
something.
slightly different. I mean, La Trobe does have its PDFs. You can access that when you go to the sign-in screen on the LMS, the Moodle,
Okay.
and up the top, up right at the top where we never go, is the help
Okay.
files.
Yeah,
Yep.
I'll have a look there. All right. I've got a coffee too, so you don't mind if I have a drink.
No, it's making me hanker for one. That looked like a pretty nice one, actually.
Hang on, where is it? I just opened a new bag of single origin from Tanzania, so it is
Oh,
nice.
okay. You bring a little
Sorry.
sample. Bring a little sample to work.
Yeah.
Pick one up. All right. Let
So
me just
I should have got the document.
at the ready. Well, while
Yeah.
you do that, I will get my screen looking at the wiki, and I'll just have a look at the instructions.
Okay. I've just got to go to my laptop because I'm talking to you on the home desktop. So
Okay.
just transfer the file over.
Oh, searching Wikiversity low vision rehabilitation.
Yeah.
There it is. I'll just zoom in on that a bit. Okay, so I'm off to the discussion page to check our notes for this meeting and start the notes for this meeting. Is that
Yeah.
okay?
Sounds good.
All right, so scrolling down, oh no, we go most recent at the top, isn't it?
Yeah.
Oh, yeah, that's right. You did tell me yesterday when I missed our meeting appointment that we're making up for now.
That's all right. Here we are.
That you have an agenda. Finalize assessment and complete and submit subject guide. Good. Divide students into groups on LMS and advice regarding evidence gathering for online content development. Can you explain that last one?
So I really just want to know it's probably better to do this in prospectively. So I really just want to know what's the best way to set up so that I'm actually getting some feedback for the content development from, I don't know, peers, students.
Right, gotcha.
Not sure how to best go about that because I'm not sure that the university's system for feedback of subjects is going to be adequate. You know, my biggest fear is not so much for the low vision rehab subject, but for the other one that I've got, the first year elective, which is completely online. I'm worried that they'll tear it to shreds because they don't have any face-to-face contact contact from me, even though there are a lot of videos. So I just want to get the best out of the critiques rather than just the students that are disgruntled putting their thoughts forward. If you had any ideas about that.
Yeah, absolutely. Do you want to start with that one, or that's probably a low priority one compared to getting the subject guide in? Do you want to look at that?
Yeah, let's do the subject guide.
Okay. Have you got that document with you? I'll share my screen and have a look at what we've got on the wiki and start transferring across, but I know we've got to work on the assessments most of all, don't we?
Yeah.
Have you decided what methods you're going to use? I think I sent you a message looking at the range we've documented so far.
I have, yeah. Can you see that?
Coming, yes. I'm looking at the subject learning guide or the template.
Yeah. The template which I've now populated. So
okay, so this is the just a lot of people get confused, and completely understandably. I just want to check. You're filling out the subject learning guide, which isn't the document that you submit to our administrators. The document that you submit to our administrators is the subject template, and it's meant to be an abbreviated version of this. So it doesn't matter. Work hasn't been lost or anything. You are double handling, but you simply copy paste from here to there is more or less what you can do.
Okay.
But you need to. This is a different document to the one you need to be submitting in a week or two.
Oh, okay. I think you did send me that, and I did open that, and it looked the same.
It does look similar. Yep, it's got
so
boxes.
I was very clever, and I deleted the other one.
Okay. Well, do you want to refresh? Get that other one?
Yeah, I'll get that. I'll get it. Well, I have to download it now from the faculty website, so I'll go and do that, and then.
You're okay with doing that? You know where to go, and
okay. Okay.
All right, but this is the one you give your students.
Yeah, and this is the wrong one for submitting to the faculty. Well, it's the same thing. All the learning goals and that are there, and how it's going to work. When I had a chat with Kerry on yesterday or the day before, I can't remember now, and she was a little bit concerned with regards to that there wasn't enough face-to-face time in this subject.
Yep.
So as a default, the subject is scheduled every Monday for 2 hours. So I was initially going to cut that down and have them only come every second week to a face-to-face class, and the rest would be online. However, I've left the default so that if she, for her classes, would like to use some of that face-to-face time, she's welcome to do that, but I'll stick to how I'd originally devised my classes to go. So
okay, that's a good plan. I did talk to Kerry about those concerns and put it to her that she could always organise informally some face-to-face sessions if you didn't do what you just said you did. So she can formally do it. I suppose the only thing you ought to worry about is, well, a couple of things. The feedback. So you'll be getting feedback on 2 types of delivery styles, given you wanted to test the fully online method. But as well.
Oh, the fully online is for the other subject, not this one.
Oh, I see. Sorry, righto.
Yeah.
Okay.
Because I'm doing 2 simultaneously. This one is like blended, and the other one is the fully online one.
Okay.
But I guess the method for getting feedback would be the same, perhaps across the 2 subjects, because it's the online component that I'm actually wanting to assess. And
just for remembering that conversation I had with Kerry, I did suggest to her that it would be unfortunate if you had face-to-face workshops that excluded people who wanted to try and keep up with the subject online. And I suggested that, when she has those workshops, that she get a little hangout running out so people can tune in and watch it and maybe even join it to ask a question. Not that we'd expect many people, if anyone, would actually do that, but it's mainly an action that we do to not exclude people who may arrive trying to do that. I don't know if Kerry would be out, because it's the first time she looked at the technology a couple of days ago, so I'm not sure she'll be in a position to actually manage that at the day. But
I'll just hang on, where am I? I'll just come back to you.
Okay.
Can you see? No. Can you see me again? Oh, you can. Okay. Yeah. So the discussion that we'd had was, because I'm using Wikiversity for development, but what I've done is basically taken all her previous content from previous years that she's got there and just devised it in a format on Wikiversity that fits an online format rather than just files inserted. Because what we used to do, both of us, is just insert a whole series of files into the LMS site, and we would support that with the online or with the face-to-face classes. But when you're delivering material online, it doesn't quite work like that. So I've formulated it into task 1, task 2, task 3, and so on, so that it's easy for students to follow that are sitting at home on their computer. And I've sent that to her components. I've sent those to her for modification, alteration, development in Word documents, and they basically just mirror what's on Wikiversity. So we've decided to start working like that. In me converting all her stuff into sort of an online, user-friendly online system, and then she'll take it from there. And how much development she'll do will be dependent on how much time she has and so on. But I think it will work fine.
All right, good. Let's hope so. And you just shout out to me if there's anything I can do to help in that transfer of the content as well. Now, so the assessments, did you arrive at a number of assessments, methods? What are you thinking here? And we'll obviously have to keep checking them back to the objectives, and are they effectively assessing all of the objectives listed? So we'll check that as we go.
Okay, so I wrote on my texter, with my texter, as you can see there.
Cool, there it is on the screen. Yep.
I went and had a look, because I really like the idea of developing the Wikipedia pages that don't have very good content around them.
So you're asking students to edit Wikipedia pages relevant to the subject, okay? Yeah,
or create, or in a lot of these instances, create Wikipedia pages.
Oh, wow. Okay, so
the content is completely missing. So,
awesome.
And I found 1, 2, 3, 4, 5, 6, 7 possible pages that would be worthwhile. So, I don't know, can you see there? So
vision, rehabilitation, visual impairment, the page just dropped, eccentric viewing, null point training, magnifying glass, visual field loss, role of orthoptics in something rehab.
Low vision rehab.
Okay, righto.
Yeah. So, for example, that last one, there is already a Wikipedia page on what an orthoptist is. It's not very good, so that needs work anyway. But I thought what they could do is there could be a section down the bottom which could be related to the actual role of an orthoptist in this type of specialty niche area in low vision, because there's nothing on that at all. So and some of the other things like eccentric viewing training and null point training, they're specific skills that you use to for the rehabilitation of a patient. There's nothing on Wikipedia, on those topics. So I thought that we could start by, because that's the first place people go to. You may as well advertise what you do on those pages and get it right.
Then there are many different ways in which you could assign the task of editing Wikipedia generally. So editing Wikipedia is kind of the big granddaddy of it all, but then it could be just simply reading articles and inserting the citation needed wherever there's a sentence claiming fact without a verifiable supporting source. That's a fairly low and easy one for maybe a first year. But what I'm doing before we decide on what exactly you mean by Wikipedia editing is I'm going back to your objectives. Analyze information about ocular disease and determine the likely functional vision impairment.
Yeah.
Maybe analyze information, but I'm not sure about the rest there. Describe barriers, prevent. So barriers that prevent or limit access to low vision services. So for that one, for example, find a Wikipedia article about low vision services or a section within an article, and then add some information in there about barriers would be a contribution, a worthy contribution, definitely, and obviously testing their understanding of that. Interpret and integrate the results of low vision assessment to inform management strategies. I'm not sure that one could be evaluate ocular pathology.
Yeah. that fits more in line with, you know, that you were talking about when people go on that Yahoo Answers and they type in a that fits actually, that fits more in. Now that you're reading out the learning outcomes, I'm starting to think that maybe the Wikipedia page is not going to quite meet the learning outcomes, because they're a lot more involved than just simply writing out facts about a particular thing. It's about thinking about the disease and the impact of the disease, and then making a judgment call about what you're doing next, clinical decision making.
Yeah, to me the only one for Wikipedia that looks like it would work is the description of the barriers. So and you think about that now in the real world. So you tell me that I've got some sort of low vision issue, and that my life is going to change, right?
Yeah.
Well, I take the name of that condition that you've just given me, I put it into Google, and I arrive at the Wikipedia entry, inevitably, usually, and I start reading about that. Now, if you've got a section in there about services, so the types of services available for people like me, and then even some information about the barriers, so that's useful information that you've chucked in there, and you are testing that one objective. So it's not to say you could scratch Wikipedia entirely, but you could use it to some degree. But talk more about the Yahoo Answers or similar kind of project. How would that work?
That would probably work better, because then you'd give the case scenario, and then the students working on the case scenario would probably better meet those intended learning outcomes.
Okay, so you're going to take the hypothetical scenario. So you're not going to go into Yahoo Answers to find a real scenario. You're going to go into Yahoo Answers and place a scenario as a question, and then ask the students. Okay, that'd be an interesting exercise. I don't think anyone in the faculty has done that yet, so it'll be a first. Good. All right, so I'll note that down.
Can they do that they can do that as a group, can't they? They don't have to. This doesn't have to be an individual.
Well, it is set up on the individual basis, but you could still go in as groups. So you've got individual responses, and behind the scenes that person is representing that particular idea, and the next person in the group's having their go. So you could still do it. It's just
I think that will work well in a group.
Yeah, okay. So I'll just get some notes down into the discussion page of our Wikiversity page. Just going to it. Go. Assessment. Going with the Wikipedia editing assignment, we decided that most methods of editing Wikipedia don't really address or evidence the learning objectives, with the exception of, what was it, objective number 3 or something of the
which was
describe barriers.
Number 2, describe barriers that prevent or limit access to low vision services.
Okay, I'll just put the ... there. Describe barriers is enough, but I'll put the number 2. Okay, so therefore, we're going to go with, we're going to think about Yahoo Answers. So we're going to, what again, can you remind me we're talking about here?
What's that?
What year level are we talking about here?
Third year, so they're just about to go on their clinical placements.
Okay.
And out into the clinical schools.
Righto. Good. Well, this Yahoo Answers one probably does fit. So without specifying a particular brand, Yahoo Answers, you'd want to describe the assignment generally. Engage in a prevalent, popular online forum.
Yep.
And address find a scenario, or put a
answer a case scenario or something. Yeah.
Yep. And then in this particular subject instance, this 2014 instance, you, the subject coordinator, are going to prescribe Yahoo answers. I mean, another subject coordinator might leave it open-ended and say, ask them to go and find where low vision is being most discussed and then intervene there. But Yahoo Answers is a very prevalent one, so it'd be interesting to see that space played out.
Yeah, and I haven't looked at that very much because I'd spent time looking at the Wikipedia pages. So I might now, I might think about have 5 or 6 scenarios and have a look at them.
Yep.
And just type in what I think, say, a parent would ask about a vision impaired child or something like that, and see what's there.
My child has low vision. Is my search. Starting a child, I have a low vision. Can my eyes still be corrected? So that's a funny kind of title. Gift idea for blind children.
What about this one? Is my son low vision?
Yep, there we go. So there's 3 answers to that one. It's a fairly extended thing. So here we go looking. So this could be you posting the scenario.
Yep.
Okay. So he sees. Can you see that all right, or should I zoom in a bit?
Yeah, can you zoom in a touch?
Yep.
Yeah, that's better.
So he's had eye surgery because he was pulling in.
Okay.
But you get the idea. So you're expressing it as though you are a real person, but I'm not sure it wouldn't be a problem if you could express this as a hypothetical scenario in a study. I mean, that would get moderated. I think that would be still allowed to play out. So this could be, Jane from group 1 is putting the group summary there, and then anyone else in the group might want to respond with comments to that. Others in the group could give it a thumbs up. Now, if you wanted to get really deep into this, you could start adding, because what you get is, you see when you hover over Jane here, 51% best answers status that she has, and she has 34,000 points. She's a level 7 answerer. So these are type of badges, I guess, that people earn engaging in this forum. What I've been wondering about is professionals, like the people you're training, getting status in their spaces and moderating them as some sort of public health campaign or something like that. But there you go. Quite a lot of answers Jane has given there. 3,820. Wow.
Compulsive answerer.
Yeah.
Look, that would work really well. I think that would work really well. And then if there's 35 or 40 students, and you divide them up into groups. What's a good group size? Like 5 or 6? Would that?
Oh, I think that's a fairly large group for this. I think but to some degree, you've got to think about your impending workload here of marking this.
Yeah.
But it's a fairly small group, relatively speaking, in the faculty. Your entire group, that is. I think it would be an easy task with 3 people. But then 3 is a bit of a crowd. You'll end up with 2 doing most of the work and the other not. Getting alienated and whatever. But 5 or 6 people might be overdoing it a little bit. Depends on the complexity of your scenario. If you wanted to have a complex scenario in there, and then each person in the group had the different role. So one person had to give the summary from the group, another person had to follow up with sources, another person had to follow up with graphics and videos that support the response, etc. They could have different roles to really give a quite an incredible response.
That would go well. Yeah. So graphics, videos.
Different roles for different information.
So textbook or references. That would work well. Okay. And what would you apportion? What sort of percentage would you apportion for this kind of assignment?
I think that must depend again on the learning objectives. So how many of the objectives do you think could be effectively assessed through this scenario? You're also ticking off from memory, it does a fair few of them.
Yeah.
You could probably do them all.
Number 1, number 4, definitely. Probably number 1, 3, and 4 would be covered definitely with this. Yeah. So fair percentage,
And so, that's one percentage. There's also think about the graduate capabilities and essentials. So you're ticking off a number there, probably all of them. it is an entrepreneurial act, I would argue, to practice this type of health intervention, to go into an online forum and post an answer and then go into a discussion about what sort of opportunities this type of intervention presents for health practitioners. Those are the entrepreneurial tick. The other one is sustainability. It's a social sustainability. You're making a contribution to the public good. And then the other one is global citizenship.
Yeah, and that is really important, because we're linked with orthoptists have a page or a connection with this online website called HealthShare, and we've sent, the Orthoptic Association has sent that around for orthoptists to be integrated in this HealthShare online information sharing forum, and they often post questions like they do on Yahoo Answers within that health community, and people can go in and find out different things. Now, we all have a user profile, and we all should use HealthShare, but I'm finding that orthoptists are actually not very good at contributing to this space. And I think part of it is that you have to have a lot of confidence in what you're saying to give an answer.
Yep.
And you have to sort of engage. They're a little bit disengaged, and I think teaching our students to become more engaged with this kind of online community would benefit the profession in the long term.
Do they have a section of their website for emerging professionals or students?
I'm not sure. I'd have to have a look. They have a section for orthoptists.
Yeah.
But when anybody posts eye-related questions, it's usually the optometrists that answer, and I mean there's a lot more of them, and there'd be quite a lot that'd be engaged with this website, and they want people to come into their shops and clinics, of course. So
well, maybe maybe you just be true and open about it. Is you might say you could do two approaches offhand to this. You set the scenario in Yahoo Answers, and then you ask the student groups who've got each scenario to go to this health share website and post the scenario and see if they can elicit any responses from there, and that becomes then a source, a supporting reference to their response that they eventually give in Yahoo Answers. But likewise, you could do it as a teacher of these professionals. You could post to this forum an outline of what you're doing and update the forum on how your students are going, and then reveal it to your students at the end of the exercise saying, I've been documenting your work here to this community, and then make the point, in future you might want to come to this community to consider that sort of engagement more. Okay, let me just catch up on some notes.
I think this would work well, actually. I think this, I'm feeling really good about this type of assessment.
Okay, so in short we're saying scenario, fictitious, are they? Fictitious scenarios?
Yeah. Well, some may not be. They'll be adapted perhaps from real cases, but obviously, no names and things.
Okay. Have you got these scenarios at hand, or?
I've got, hybrids of things that I've used in the past that could work. I'm just having a look. Yeah, I've found one that I've used in exams in the past.
Yep. Okay. So it's really quite an interesting exercise. When you post the scenario from those exams in the past, you'll get different responses from the group. Some group will go completely offline and prepare it up to a finished point and then post it at the due date.
Yeah.
And that doesn't leave you any opportunity to intervene. So unless you were to give prompts in the subject saying, your first and initial response is due at week 2, which would be unfortunate to have to structure it that way, but you might need to do it for some students. So that gives you an opportunity to intervene if they're not taking the right track or if you think they need to cover something else. But where it's leading to is in the end you've got this forum that leaves a track where you've posted the initial question, you've got some of the initial responses, and then you've come back as that fictitious patient saying, okay, I think I understand this, but I'm a bit unclear about that. So you're role-playing that patient out some more, and they've got to keep responding to that. And that response could be another group member's responsibility. So others have to do the research, and one of them has to summarize the response and make sure that that person feels like their concerns have been addressed. You're also going to have the issue, though, of others in the community, the Yahoo Answers community, offering their responses. So this is a bit of an unknown. I think you could still go with that, but you have to design it in with the students saying, you will have to manage your responses along and incorporate the responses of others. So if they get somebody coming in with some sort of, I don't know, pretty bogus natural therapy or something like that, not saying natural therapy is a bogus at all, but you know, something like that, to use a bad example, then your students are going to have to carefully manage that situation, aren't they? And
well, I think that'll be good for them, because I think that will just mean that they need to think more carefully about what they're saying, and then moderate an answer, because they'll get that when they go out into clinical placements coming up very soon. They'll get people asking them, you know, for weird and wonderful things to treat, you know, curable eye diseases and so on. So I think it's not a bad. I think it's not a bad thing to leave it out in the open, because that's the reality they're going to be faced with in a clinic anyway. They're going to have family members asking if, you know, they've heard about this throw your glasses away therapy and sitting out in the sunshine to cure macular degeneration or whatever, and they need to know how to answer that. And answer that
takes on board some sort of relative who's saying something, and What about there's the other thing is that you might think about testing is that Yahoo Answers has been an online community for, well, very long time now. So when you post your scenario, there may well be already a very similar scenario on Yahoo Answers from 6 years ago, and you don't want to. Maybe as the teacher, you'll first of all check that, does the scenario exist? If it does, that doesn't mean you stop posting the scenario. It means you've got a little bit of a tap up your sleeve to see if the students research answers for responses, because that's using the community's resources for the community. You know, it's not outside in so much. They point the answer back to a previous forum, which would be a wonderful thing to see happen, especially if that previous forum was a good one. Okay.
And how do I then integrate? So say we'll have several groups and several scenarios. How then do we gather together and share the answers and so on with everybody else, so everybody else has the benefit of
well, there's a couple of things. I mean, one off the bat might be overdoing it. You've got another thread going in Yahoo Answers, which is a question exactly as you asked. How do I get this group together, and they come together and use the Yahoo Answers as a forum space to get together. The HealthShare was another one. You could set up a little channel in HealthShare. Admittedly, it's only text-based, but you could add to that with this tool we're using now, Google Hangouts. So you might say for every scenario, we'll have a regular meeting time each week, to which you, the teacher, may or may not be present, but the time is there and the room is set, and people can arrive and talk about it if they want. And if they don't, then no one shows, no big deal. But it's kind of like those open workshops. They're sitting there for people to use if they want to use it. So you might sit there, if you did a Hangout on air recorded, you might end up the teacher arriving there and being the only one in the room. That shouldn't stop you. You just now turn on your screen share, go to Yahoo Answers, and talk about what's happened, what they've done, and what you think people can do, and they can watch the recording later. Or not.
That's right. Yeah, that's right. Apart from, you know, usually what we do when we get them to do individual assignments like that is get them back towards the end of semester and make them present to each other, you know, 15-minute blocks, which is, it's tedious and boring for everybody involved. I don't know.
Yeah, totally.
But presumably, I mean, if we have this due earlier in the semester, and then we also set up an exam situation, they should look at these Yahoo answers before they go into the exam, because some of they might be able to use some of those answers to answer their exam questions. So maybe that's a way to.
Although I'm just to throw it out there, is the exam your nice little gateway before people can start engaging in this public forum? So they have to pass the exam before they can attempt the second assessment. And what the exam is testing, if they've got the fundamental knowledge down pat before they go and, you know, start contributing to public forums. But you're moderating it as the teacher.
Yeah.
So anyway, it's just sort of questioning the order. What might the exam happen before the community engagement exercise, or vice versa, as you were saying?
Well, that could work well. I mean, I'm turning everything up on its head, and so traditionally we would do the exam at the end to assess all the knowledge, but it might be that we can put an exam in somewhere a bit earlier. One of the other issues with this subject is that it's a 9-week semester because they go on clinical placement. Yep. So it's a very short and compact. I'll think about that though. That's probably not to get some of the fundamentals right. And this is something that Kerry keeps talking about too, and I think it's valid. She says that they don't get the concept of understanding the psychosocial impact of vision impairment very well. So understanding the feeling and the grieving that goes along with being diagnosed with an irreversible ocular condition and vision impairment. So maybe if they can jump that hurdle first and we can assess that early on, and those topics are presented early on, then they can go on and start the forum, and that would probably work quite well.
So is that instead of the exam, or is that was the exam just placed in that?
Yeah, maybe I can't hear you now.
Testing.
That's right, it's working. Yeah, that used to be one question or one series of questions at the start of the exam.
Okay, so like a written response exam. It's not like an ABC exam. It's you get a question. And
short answer. But we could move it earlier in the semester, say at week 4 or 5, get it done, and then they study for that. But simultaneously with that exam, they start on the Yahoo answers. That'll probably work.
I think it would, and what you could do is still post the scenario to Yahoo Answers early, so the students knows it's there, but you're asking them not to respond until after the exam when you give them the go-ahead. What you get the benefit then is you get the Yahoo Answers community responses in before the students, because you can probably anticipate, based on the culture in the Yahoo Answers community, that the students will overwhelm what is normally done. They'll have a lot of sources, they'll have imagery and video and all that sort of stuff to respond. So they'll go over and above what's normally responded with, but they'll also have the benefit of seeing what others have posted in response. We just got to check the time frame. I think most questions have a time frame for being open, but from memory I think it's actually the person who posted the question who closes the forum when they feel like they had their question answered.
Yeah, so that's an action for me, that to go and check what scenarios are already existing in Yahoo Answers and whether there's anything similar, and do like a little bit of an expedition in that arena, because I don't know what's out there.
Look at the policies on Yahoo Answers and the things like that. So you're going into territory that I'm not as familiar with. Whereas if you were doing Wikipedia, I'm quite familiar with that and be able to guide you quite well. But with Yahoo Answers, like I said, no one else in the faculty has done it. I personally haven't done it in anything I've taught. So it's just a concept, and you're going with it. Good on you.
You lead me astray every time.
Okay.
That's all right. Good. So one more question before you go.
We're not going. We've got two more agenda items to do, and we're running out of time.
Well, this is where I was going to bring that in. So how do I start getting feedback about whether they actually like doing the assignment like this?
Rightio. So what I would use is my own independent survey forms. So your Google Forms is nice and easy to use. You've probably used SurveyMonkey before, but Google Forms is like that, but easier.
Yeah.
And what I would do is micro questions, 3 or 4 questions a week that wouldn't take more than 5 minutes to do, accumulating towards something. I'd probably ask questions that reinforce the intent of the overall student feedback survey,
Yeah.
but along the way asking some ones that are not being asked. And I would probably try and explain myself before asking for the responses. So if you're asking for a response on what do you think about learning online, well, you're throwing yourself out there because you've got a demographic. You've got people who have probably enrolled in the university because they imagine it in lecture theatres on campus and all that sort of stuff, and now you're throwing them an online subject, so they're not your target market necessarily. Whereas if you're at Open Universities Australia, they're looking for an online option and flexibility. So why I'm bringing that up is that you might need to explain why it's gone online to your group so they can make somewhat of an informed decision. They might be able to reflect on what it is they think they want and go, oh, well, yeah, I guess it does mean I can work a few more hours at my job rather than come to the class and all that sort of stuff, where they might not have given that response up. So I would record with Hangouts on Air a little 4 minute explanation and then end it with your little link to the survey. I'm not sure what that does to the data, if it biases it or whatever, but I think that's dependent on what you put in that video.
And how does the university feel about me running my own Google Form survey?
I haven't seen anything wrong with that, because you're not stopping them doing the thing. What you're basically saying, I should say this, is you're asking these questions so that you can adjust and correct the subject as you go, whereas the other one is a summative survey that affects future students. It doesn't really pay off for them to give a response there. So what you're pretty much interested in is trying to get some feedback early so you can change things now.
Yeah.
And things like, are you clear on the 3 assessments? Yes or no? That's a quick one. And if you get 90, or if you get 55 no's and 5 yeses, then you've got something to do.
Yeah. Yeah, that would be good, actually. Gauging early whether they're actually connected to this subject and how it's going to be structured would be very important to me. And designing this like this is very important to me. I want it to work.
Yeah, okay. Well, remember, it's your first instance. It usually takes 3 goes to get something right in this environment. But,
Okay.
you could, things like, I wonder, if you did a weekly question, you could ask, are you keeping up? If you don't get many responses in week 3 questions, you know that they probably haven't come to week 3 yet. They haven't seen the survey link. And then you're going to get some who are saying, no, I'm struggling. So you get some early intervention data there.
Yeah. Okay. I think I'll do that just to gauge what's going on throughout the semester.
Yeah.
So, all right. So with the the faculty form.
Oh yeah.
That's due next week, is it?
It is. So next week, July 7th, I think. So not 2 weeks away.
Who do I have to send that to?
Sally Collins.
Oh, yes. Okay.
Yep. Or I think you can send it to Sally Collins through your department's student services officer.
Yeah.
So what you've got to focus on in that is don't think you have to go to anywhere near the extent you're going on the learning guide.
Yeah.
You've just got to have your 2. I think you've got 2 assessments in this subject. 2 is good.
Yeah.
You just need to give them a title, and if you wanted to, an equivalent word count.
Yeah.
Yep. You can't go over 3,500 words for an undergraduate 15 credit point subject in total. So, I don't think you're going to go anywhere near over that. I think the Yahoo Answers might be worth 2,000 words at the most, and it's a group work assignment. So, and then the exam might be 1,000 words.
Yeah.
It's not a target, that 3,500 words, by the way.
Yeah.
So, and then you're just giving the assignments or assessment methods a title. You're indicating what learning objectives they're assessing, and an equivalent word count maybe. You're putting in the subject learning objectives and the types of teaching activities you're doing. So you're doing discussion, workshops, and if you're not detecting it already, I'm trying to avoid the use of the word online, as though it's something different. Where you and I are having a meeting, and it happens to be online, but we call it a meeting. Yeah?
Meeting, yeah.
Yep.
Yeah.
And the description. Let me just send you a link to the structure. Oh, we've already got the description in the wiki, so that's fine. I'll just go back and check that it's following the... Oh, no, it doesn't have a description in there. Okay, so let me just turn on the screen share and show you where I go to get the description. New tab, Wikiversity. Did I spell that right? No. Development for teachers of health professionals. Now, it's a very convoluted path I'm going to take you on here. But this is the homepage for the professional development program that I've written and hoping others may follow one day. In there is the Connect and Communicate. This is the schedule of things, which is you've already done that. You've come to Google+, you're now connected and communicating with us. Yes. Now the subject and course development, you're up to this stage.
Mm-hmm.
So open that one up. And there's a suggestion, these are the 6 goals for that, this section, subject and course development. And there's a course here that existed on Wikiversity that I've picked up. Creating accessible courses. Now in there, this is now looking like your subject. So we're at the subject level of a program now.
Yeah.
Develop and publish a course outline is the first of the project. This is exactly what you're doing. And in there is the steps of the outline. You've done most of this already. There's this third part, the description. So I'll copy the link to this page and send it to you in chat. Yeah. But it's the third one. You want to follow that structure when you write the description, and I'll obviously follow up with some copy editing. So that went into the chat in case you didn't get that link.
Yeah, it's come through. Yeah. Oh, that's good. That's good because yeah, I don't know why I missed that, but because the others in my department are also changing the way that we deliver subjects, and so this is going to be useful for everybody, I think.
Okay, I mean, I could do with some advice on how to simplify this path, and as you are, I'm using Wikiversity as a developmental space with the intention one day to create a website which is all user-friendly and graphically designed for this professional development program. But until then, this is where it is.
Yep.
Okay, so as for the groups, none other than our man Grantham has walked into the room.
Yay.
Now, Grantham, we're in a hangout on air, so that it's recorded off to YouTube. But Grantham, would you be able to show us how to assign groups in Moodle? If I get up the LMS, yeah, that's right. Or I think it's just a general in the subject. I think it's a general overview of grouping people. So you're creating groups of a cohort of students in the LS. And this is Mary. You know Mary?
Yeah,
Let me
hi.
Just
Can't hear me. Hi, Grantham. Hi, can you hear me? Yes. Can you hear me? Yeah. Okay, so I just want to know how to create groups so that the students either they're randomly assigned into the group or they select which group they want to go into. I don't care which way, but I just don't know how to do it in LMS.
You need to create a group selection tool.
Yeah.
So you need to go add an activity or a resource.
Add activity or resource.
Yes.
Are you showing me?
Are you seeing this screen?
Yep.
Seeing the LMS?
Yes.
Okay. So we need to go into a subject. Your example one, where is a good place to do this?
Your playpen.
Okay.
turn editing on. Okay, scroll down to topic 2, Lee. Keep going. Stop. Add an activity or resource. Group selection. Click the radio button. Keep going down. Stop. Click add. Okay. Now the name should be a clear instruction of what you want the students to do. So this should be, please sign up for your group.
Yeah, I was doing this completely the wrong way. Now I'm
So-
seeing how it's done.
So introduction, you place anything here really,
Mm.
but usually this would be you can find yourself to attend that time. Please also another. Allow selection from. Now currently it says all groups because Lee doesn't have any groups in his playpen, so we'll leave it as that because we can't do much else. Default max members per group. Let's make that 3. Okay, and now click save and return to the subject. Okay, so all we've done now is we've just made the link. We haven't actually made any groups at all.
Yeah.
So in the administrational block on the left-hand side, click on users, groups, and now you'll need to create a group. So click on the
Oh,
word
this is where I was going the other day trying to do this, but I didn't do that first bit.
Yep. So now I want you to click on create group, and let's make this group name Monday 10 a.m. And then click on save changes. You don't need to type anything, it's not mandatory. Click on save changes. Create another group called Tuesday 10 a.m.
So you can essentially create as many groups here as you like.
Yes, these are groups, Mary. They're not groupings, so just be aware of the difference.
Yeah.
And make another one called Wednesday, please. Okay, so save changes. Now in the groupings, which is the tab in the middle, right up the top, click on the word grouping, and you're going to create a grouping. And we're going to call this grouping tutorial times. Save changes. And now what we need to do is assign Monday, Tuesday, Wednesday into this tutorial group. So over on the right hand side in the edit column is a group of people. Click on the people and you're going to add those 3 groups to the grouping. Click back to groupings. Okay, now go to the front of your page, which is called, in your case, Lee, Codeless. Yep. Click on, scroll down to where you made the group selection link. So scroll down. Okay. So click on that, and you should see nothing there. Oh no, it's done it. Okay, it's done it. So what it's done, it's looked for your groups, and it has basically offered those 3 times. Now for Lee to enroll under administration, and on the left hand side, switch role to student, please, Lee. Okay, now enroll in either one of these in the action column, enroll. And this, do you want to enroll? Enroll. And then that's it. And then Lee can only enroll in one, and then to unenroll, all would appear again.
Was that clear, Mary?
I mean, you've got
Very
the recording
clear.
to go back to it. Okay. Right. So the distinction there between groups and groupings was something I didn't know for sure.
Yeah, that I was not doing it the right way at all. I'd gone to step 2 before I'd done step 1, so that's perfect. That really helps a lot. Thank you.
Okay. All right then, Mary. I think we're done with the agenda items, and we're 1 minute over time. So
Okay,
I think,
perfect.
okay.
Okay, that's great.
All right. I'll save the notes that we've got into the wiki, and see you again in next week.
Yep, and this video is going to be available, isn't it, on
Teachers,
Google
health
Plus?
professionals,
Yeah,
and I'll
yeah.
notify you in there of it. Yep.
Yeah, great, because I want to check that grouping thing and stuff. So that's good. Thank
Yep.
you. Thank you,
Adios.
Grant. Bye.